I completed my fieldwork term at the Cathedral Center for Wellness, which is a naturopathic wellness center located in Cathedral, Regina. The clinic is comprised of 4 naturopathic doctors, a body talk practitioner, and reception staff. The objective of the team at this clinic is to optimize the health and well-being of their patients through individualized care and education. They approach patient care by addressing the root cause of disease rather than suppressing the symptoms. As a fieldwork student at this clinic, I have had many opportunities to learn and grow as a young professional. My role as a fieldwork student involves shadowing naturopathic doctors, receptionist duties, assisting during IV days, and creating a welcoming environment for patients. For the first month of my fieldwork term at the Cathedral Center for Wellness, I brainstormed different ideas for a project with the help of my supervisor. My supervisor focuses a large portion of her naturopathic practice on cancer care. Therefore, I felt it would be best to explore different ideas in this area. A system my supervisor uses in her practice, called SmartND, was going through some updates that would allow for new functionality. These new updates had potential to improve and simplify the way she made cancer plans for her patients. The purpose of my special project was to create a new process by which Dr. Stark could create cancer plans for her patients. The idea of reworking her system into SmartND was to simplify the cancer plan creation process and to improve workflow by having all the information easily accessible in one database instead of scattered throughout different plans. Essentially, what I did was compile the information from over 50 different cancer plans and organize the data into different categories. This was a big project for me to take on during my fieldwork term, so I broke it down into several phases. The first phase was understanding how Dr. Stark organized her plans. What was the logical flow of the plans and how I could replicate this in SmartND. The second phase was going through already existing cancer plans and compiling the information from those documents. I then organized the data or recommendations in a way that I could easily enter them into SmartND. Phase 3 involved entering the data I collected into SmartND. To do this, I had to create a dispensary, which would allow me to enter the product name or recommendations, their descriptions and product details, and dosages. I saved these entries as protocols so that they could be easily accessed by Dr. Stark or her locum in the future. During Phase 4, or the final phase, I combined the protocol entries into templates that were saved in Smart Charts. There were similar protocols or recommendations that arose based on the needs of patients and in research. I created several templates: basic chemo support, radiation support, surgery support, osteo support, and heart support. These templates are easy to access and can be modified if needed. The project was a success, and Dr. Stark is eager to start building cancer plans for her patients in SmartND. She also believes it will help her locum transition more smoothly into her unique practice. I learned a lot as I worked through the different phases of this project. I was able to learn about how a naturopathic doctor administers care to patients with cancer by reviewing previous plans made by Dr. Stark and from research. I was able to collaborate with my supervisor over the course of this project as well and learned about different perspectives on cancer care, which have changed the way in which I view disease and health. Beyond learning to think like a naturopath, I felt this project has helped me improve my organization and communication skills, as I had to ensure the recommendations and templates were designed in a way that made it easy to use by professionals and easily understood by patients. Very few things go as planned in the real world, therefore adapting is a valuable skill to learn. This project has taught me to be adaptable to different situations and needs. I was able to also collaborate with my supervisor and help make her vision of creating a new cancer plan system come to life.